All right, looking at the clock, we're at 6:02, and it looks like our participants have leveled off. And so we're going to jump right in. Thank you so much for taking the time to join tonight's virtual MRRA Town Hall. Welcome to each and every one of you from your living room, from your car, from the office. If you're working late, we're glad that you are here, and we look forward to having a productive conversation tonight. My name is Jeremy Herman. I'm one of the members of the communications team here at the Department of Corrections. You may have been expecting Commissioner Schnell and Communications Director Lurkey to be guiding our conversation tonight, but they're unable to join us this evening. So I will be your captain. Buckle in and enjoy the ride. We're going to have a good journey tonight together if everything goes well. So we're also joined tonight by panelists, which include MRRA project leads Karley Jorgensen, Kate Frykman, and then our Director of Victim Services, Liz Richards, will be presenting throughout the session as well. So we'll look forward to hearing from them. I'm going to touch on a couple housekeeping items to keep things moving along. You may require or benefit from captions during this session, and there's a button on your control section that you can turn that on under video controls. Heads up that we are recording this session, so that will be available in the coming days on the DOC's public website. Look under the MRRA page, and it will link to this other site that we use for public engagement called Engagement HQ. The session will be available for your viewing in the future from there. If you need any assistance with digital accessibility needs, you can contact our colleague Rose Whitty at the email address on the screen or that phone number 612-505-4091 anytime throughout the session tonight. So if you need a minute to jot that down, I invite you to do that now. She'll be available to handle any concerns or questions that you have regarding accessibility. Moving along, again, a reminder that this session will be recorded. So everybody needs to know ahead of time that that's being done. So we can't hear you, attendees, so no worries about your privacy in that regard. You're not part of that recording, just us panelists. And then finally, we want to encourage your engagement through the chat tonight. That's where you can submit your questions. And at the end of the session, we will set aside time to engage in a Q&A. And please take advantage of that because the engagement will only be as good as the amount of questions that we get to address. So I'm really looking forward to handing over to Kate Frykman now, and take it away.
Good evening, everyone. There are a number of people joining us this evening, and so I just welcome you all. I thank you all. We're very grateful for your attendance, and I hope you're all warm and safe. My name is Kate Frykman. I work alongside and walk alongside my partner, Karley Jorgensen, in this work. For those that I haven't been able to connect with yet in a town hall setting or space, I joined Karley last January. And so this has been a really great opportunity to work on something that is incredibly transformative to our corrections system. So this evening, we're going to really focus in these three different areas: the earned incentive release, policy background, and key changes, which Karley will walk through in a minute. Our MRRA policies, their implementation plans, how and when they will roll out, and then we'll conclude with a question and answer session. So with that, Karley.
Thanks, Kate. So we'll kick it off here with a very brief history on the MRRA policy development and revision process. The Earned Incentive Release Policy, as you all may recall, was first published and approved in January of 2025. And when it was approved, it was done so with an understanding that process testing would reveal gaps and needed adjustments before the policy was scheduled to take effect. That process testing, which began in April of 2025 at the Moose Lake and Shakopee facilities, then informed critical revisions to the policy. These updates were reviewed by our stakeholder groups, and in late 2025, those policy updates were finalized, and then Commissioner Schnell was presented the policies for final review. In December of 2025, the earned incentive release and earned compliance credit and supervision abatement policies were both approved and can be located on the public's policy website. The earned incentive release policy is scheduled to go into effect in February through phases, which we'll outline later in this presentation. And the preparations for earned compliance credit and supervision abatement policy implementation are already underway, with individuals releasing from prison to the community on or after March 2nd, 2026, being eligible to begin earning compliance credits and working towards supervision abatement when their county or district is ready, but no later than by September of 2026.
So as Karley mentioned, we endeavored with over the last year to participate and to embark upon some process testing, and we learned a lot through this process testing. So group one, or the round one of process testing, began in April of 2025. We embarked upon a second endeavor of process testing in August of 2025. Therein, the first of the releases for earned incentive release began in September of 2025, and therein have followed essentially monthly since that time. In December, we found it critical to embark upon a third round of process testing. And all of this cumulatively together has not only informed revisions for the earned incentive release policy, but really shaped how we're going to approach implementation starting in February of phase one. So Karley mentioned some revisions, and she's going to go into greater detail regarding these revisions, but they essentially fall into these five really kind of buckets or categories. The first being one policy for all, simplifying in nature. Additionally, we added a new category for earned incentive release credits, which Karley will break down. Then there's more details on the construction and development of individualized rehabilitation plans. The ability to rescind and revoke earned incentive release credits will be detailed out, which was a legislative change in this past session. And then creating a limited program capacity release pathway.
So to begin, while we were preparing for process testing, a standalone approach had been created to review individuals for earned incentive release, primarily considering what they had already done and accomplished while incarcerated. This approach acknowledged the difference between looking backwards at what people had already done versus looking forward, which will happen as the policy goes into effect and people are newly incarcerated in February. So that standalone process, often referred to as retroactive earned incentive release review, made a lot of sense to use while we were process testing. However, as we made revisions to the policy, as Kate mentioned, it made sense to unify those two processes, making it simpler and more understandable for everyone about how the process would work and the guidance for earned incentive release. So the updated policy also offers more information related to individualized rehabilitation plans, specifically outlining how and when they're developed and more clarity around what's included. The next key revision, excuse me, relates to programming and earned incentive release credit. So the MRRA comprehensive assessment process helps identify areas that can be targeted to reduce how likely someone is to break the law, often referred to as criminogenic needs. The assessment, though, also identifies areas that can be targeted to increase somebody's overall wellness and stability, which is often referred to as responsivity needs. So the updated earned incentive release policy now offers individuals the opportunity to earn incentive release credit for completion of qualifying responsivity programming. So here you can see some examples of responsivity needs. Individuals who complete programming delivered by trained individuals and designed to introduce knowledge and skills related to those specific needs could receive earned incentive release credit. So again, programming which targets mental health or trauma, parenting, or religious faith and spirituality could allow people to earn additional credit toward earned incentive release. Additionally, some revisions were made around rescinding and revoking credit. And as Kate mentioned, during the last legislative session, the MRRA law was changed and now allows the DOC to revoke earned incentive release credit for behavior occurring during incarceration. So, based on this change, the earned incentive release policy was updated to include two separate processes by which earned incentive release credit may be reduced or denied. So, earned incentive release credit may be rescinded if an individual fails to satisfy the requirements for earning it. So, examples would include not completing a required recidivism reduction program, not adequately preparing for release, or having an open criminal case or an active warrant or detainer. Additionally, a process is now in place for credit to be revoked for behavior that takes place after it was awarded, specifically if an individual obtains discipline or commits new criminal acts while incarcerated. The final significant change to the earned incentive release policy was the introduction of limited program capacity release. So, limited program capacity release was initially envisioned to be a standalone policy. However, the LPC release process has been integrated into the earned incentive release policy because the law calls for a single policy which guides earned incentive release opportunities. The LPC or limited program capacity release process is still in development. And so you'll find it within the phased implementation section of the earned incentive release policy. Given it isn't finalized yet, details aren't available. However, we do remain committed to seeking feedback as the developmental process unfolds, and we'll be connecting with a variety of stakeholders on this part of the policy. Once it's been finalized, the limited program capacity release policy will be piloted with necessary adjustments being made before access is opened more broadly.
Now we're going to go into a little bit more greater detail on the earned incentive release policy rollout. And just to mention that this policy rollout or the implementation plan, the phased implementation plan, was done in a very intentional and mindful manner in order to allow for continuous process improvement and to manage capacity. The earned incentive release policy rollout falls into really four distinct phases. Phase one is really initial implementation, and Karley will talk more about where and how and the different parameters of phased implementation. But phase one, February 2026, is the initial rollout. In phase two, in September, is when the discipline will be addressed. Discipline exclusions will be addressed, and we'll have a greater level of understanding. Phase three is when the offense-based exclusions will be removed. So that's in March of 2027. The offense-based exclusions will be removed. And in phase four, late 2027, is full-scale implementation. Again, slow and controlled for process improvement, continuous improvement, and in order to manage capacity. So baseline eligibility criteria that show up in all of the phases across the board are really listed in front of you right now. So individuals must not be serving a life or indeterminate sentence. They must not be subject to good time. They must not be serving a non-Minnesota sentence. They must not have had less than 1 year to serve upon admission. They must not have had any pending criminal cases, open warrants, detainers, or custodial obligations to another jurisdiction. They must not be very high risk according to the MinStar. They must not be assigned a predatory offender level 3 by the end of confinement review committee. They must not be within 6 months of their current confinement release date. And they must not have more than 6 months before serving 50% of their executed sentence. Now, Karley will go and discuss the additional parameters in the phased implementation.
So, beyond the criteria that Kate just shared, each phase includes some additional requirements. As you can see here, in phase one, which will begin next month in February, individuals must either be low or medium risk, have no formal discipline during their current incarceration, and must not have any active offenses on the MRRA, Earned Incentive Release Deferred Review Offense List. In phase two, beginning in September, the process will open up the possibility of review to those who are high risk and also those who have limited formal discipline. Use of the MRRA, Earned Incentive Release Deferred Review Offense List, will continue in phase two. As we shift to phase three in March of 2027, the MRRA, Earned Incentive Release Deferred Review Offense List, will be dropped. In phase three, the remaining additional requirements will be limited formal discipline before we reach full implementation in late 2027, at which point only the criteria previously outlined by Kate will apply for review consideration.
So as Karley mentioned, and just to reiterate again, the requirements for phase one is that the individual has to have a current MinStar of low or medium, no formal discipline, no offenses on the MRRA, Earned Incentive Release, Deferred for Review offense list, and must have completed or be actively involved in the required number of recidivism reduction programs, one for those who are low and two for those that are medium. These phase one requirements will flow about as follows within these facilities. In February, we'll be in Moose Lake, Shakopee, and Faribault. We're currently onboarding and moving in to, and we'll be preparing to be in Lino Lakes and Stillwater in March of 2026, in June, St. Cloud and Red Wing, and in November of 2026, Oak Park Heights and Rush City.
We'll now invite Liz, our Director of Victim Services and Restorative Justice, to jump in.
Thanks. So I head up the department's Victim Services and Restorative Justice unit, and we're responsible for victim engagement within the MRRA process. And Victim Services and Restorative Justice does a wide range of work with and for victims within the Department of Corrections, not just with the MRRA. But I want to talk specifically about what the MRRA requirements are and what we're doing specific to MRRA first. So this is work that is done by our victim service specialists, and it includes providing information to victims about the MRRA and about the processes and how they can be involved and engaged. We also provide support to victims to help them get their input into the process in a meaningful way. And then we also refer and connect victims to local advocacy and support systems. And we do this work in consultation with county attorneys' offices and the county attorney victim witness staff specifically. So when we look at the timeline, what this means, the specific steps that we take is the first step that we take is that we identify, are there any individual crime victims on a case? And if there are, do we have valid contact information for them? Once we locate valid contact information, we will make contact with that crime victim, provide them information, answer questions, see if they want to provide input into the process and be engaged. If they do, we'll keep them informed throughout the process and will help facilitate their input at the relevant points in time. And at the time of release from a facility, whether it's earned credit release that changes their release date, or whether it's release at their standard release date, we will provide them information as to their supervising agent, conditions of release, and also connect them with local advocacy services. So we have already started this process on any case where a person is serving a year or longer at the time that they come into the DOC facilities. We started this process in November of 2025, and we will continue doing that going forward. For individuals who are incarcerated before November of 2025, we start this process once that incarcerated individual is approved to undergo the EIRC review. And so those are the steps that we do throughout the process. And what we do, the system that we use for notification of victims is the Minnesota Haven system. And this is not a system that's specific to MMRA. It's been in place for a number of years, and it provides notice on any incarcerated individual within any of our DOC facilities. So it's a system that provides notices of custody changes. So things like if somebody is transferred from one facility to another facility. It provides information on releases. It also will provide a notice if an individual is approved for any program that could impact their release date, such as our Challenge Incarcerate program, or also now MMRA. The Haven system also provides the opportunities for victims to have input, and that's not just specific to MMRA, but it does include MMRA as well. So we encourage anybody who wants to stay informed and to participate to register in Haven. We would note that victims can opt out of this system either initially or at any point in time if they no longer want to be participating or being kept receiving notices. They can also opt in at any point in the process. And that's the information we send out to folks when we locate them and first contact them. But it's also information that's available on the DOC website around Minnesota Haven. We just note that victim engagement is critical to the MMRA process and to all of the work that we do at the Department of Corrections. MMRA requires us to have early engagement with victims, and we believe that early engagement is best practices across all of our work. And so we are applying this approach not just to MMRA, but we're expanding that to more broadly to the work that we're doing to make contact with victims early, to encourage them to get registered in the Haven system so that we can keep in contact and keep them informed throughout the process.
Thank you so much, Liz, for that overview on the victim engagement aspects of MRRA. We'll now shift into providing some examples that help to illustrate how the criteria and requirements in each phase might apply. So we want to highlight that these 3 cases are fictitious, they are not real people, and it's really designed to help demonstrate how this could look for people as we move forward.
So as Karley mentioned, these examples that we're going to provide are meant to illuminate the experience, but it's also meant to illuminate the dynamic needs and experiences and journeys of people throughout their incarceration. With that being said, this is the first time that we've kind of done this. And so we're hopeful that this is helpful to show how this could potentially look. So first, we're going to give an example of Samantha Strawberry. Okay, so Samantha came to Shakopee in 2022 for drug sales. Samantha's assessments noted education and employment as her highest needs areas, and she agreed. She agreed that education and employment were important, and she was going to be motivated to complete this programming. Samantha worked hard, and she earned her secondary education credentials. She studied, and she passed all of her tests to earn her GED. She's now participating in Employ, another recidivism reduction program, and is learning about her job skills and her job interests and ready to put those into play. Because she remained discipline-free and she addressed her highest need areas through programming, and she meets all other earned incentive release requirements, in February, she can request to be reviewed for earned incentive release. Okay, so individuals like Samantha who have completed or are in their programming that address their highest needs areas, they can request to be reviewed. This is a very robust review process. And so when individuals are able to, they can see if the parameters are true for them and they can request to be reviewed. So this is the phase one. This is an illumination of the phase one parameters and criteria for review. And this will unfold in Faribault and Moose Lake in February of 2026. Individuals who have a similar experience and backgrounds to Samantha in Lino Lakes and Stillwater will be able to apply or request to be reviewed in March. The same goes for St. Cloud and Red Wing in June, and again, Oak Park Heights and Rush City in November.
Our next example is Daryl Dragonfruit. So Daryl came to prison in May of 2024 for criminal vehicular operation, substantial bodily harm under the influence of alcohol. His high needs, as determined by his assessments during intake, were substance use, self-identity, and antisocial peers. Daryl completed the Thinking for a Change program, which is a recidivism reduction program, and is currently on the wait list for substance use disorder treatment. One day, Daryl got into an argument with a peer over phone time, and rather than walking away and staying focused on his goals, Daryl shoved the peer and they began physically fighting. As a result, Daryl received formal discipline. Because he received formal discipline, he will not be able to request review for earned incentive release during phase one. If he is reviewed in future phases, Daryl would address the discipline through his success planner, noting other ways he could have managed this situation and skills he's learned since the fight that could apply. So the MRRA process is about completion of programming and demonstration of progress and change. And during the Earned Incentive Release Credit Review, Daryl would explain what he's learned since that fight and the skills that would have allowed him to make a different choice and different choices he could make in similar situations he's faced with in the future. So there are a lot of people like Daryl, who have had one or more discipline violations since coming to prison. And while having discipline will delay their ability to be reviewed, it will not exclude them indefinitely. First, reviewing those who have engaged in positive and pro-social behavior throughout incarceration really fits with the vision of incentivizing that kind of behavior. In many ways, they have been working toward earning incentive release even before earning incentive release was a possibility. Additionally, prioritizing reviews for those without discipline will help avoid really significant backlog. The MRRA team would not have the ability to efficiently review everyone meeting requirements, especially since those who have a discipline history will represent a more complicated review process. As we discussed earlier, in phase two, those with limited discipline will have the opportunity to request review if they're meeting all the other requirements. So our next example is Mario Muskmelon. So Mario came to St. Cloud in 2001 for a murder conviction with a non-life sentence. His needs were substance use, family, domestic, and employment. He's participated in many programs and is discipline-free, and he's very focused on improving himself and accepting responsibility for his past decisions. Mario will not be able to request review for earned incentive release during phase one or phase two because murder is on the deferred review offense list. However, he still has an out date, that 2/3 of his sentence. So if Mario remains eligible, he could be reviewed during the third phase. There are many individuals like Mario who have done very well while they've been in prison, improving themselves, and they're very eager to be reviewed and explain the ways that they've grown and changed. We recognize how frustrating it will feel to them and to their loved ones that their review is being delayed based on their offense. The deferred review offense list is a necessary way to manage capacity for the comprehensive review process, for us to continue gaining experience with earned incentive release, to finalize and improve processes, and broadly complete victim identification and notification processes. While this means that some individuals will transition to the community on their 2/3 release date and not sooner, we believe this is a critical step to introducing MRRA in an effective and responsible way that will build public trust.
And now in the final portion of our presentation, we'll begin to talk about the Earned Compliance Credit and Supervision Abatement Policy Phased Implementation. And so this is also a phased implementation and was done so in a way to allow for really critical and important software updates to the data and information management systems utilized by community correctional supervision, and to allow for training of the staff that will be key to approving and considering earned compliance credit and moving forward with supervision abatement. Okay, this infographic, which is also on the public website, details the phased implementation plan. So the phased implementation for earned compliance credit and supervision abatement began in September. And so there was developing materials and creating and beginning a pilot program. The technology updates in this plan began in January of 2026. Sorry, I have to with the software becoming available, there was training with agents and some shadow testing that was beginning. Beginning in March of 2026, individuals will have the opportunity, if their supervision districts and or community corrections agencies are equipped with the necessary software to be able to do so, and training will be able to begin earning compliance credit at that time. Further implementation follows through in July, and with final implementation of this entire process in September of 2026. Okay, now we're at our question, comments, and feedback portion.
All right, we made it. Thank you to everyone who has been submitting questions throughout the presentation. We've been compiling them and getting them ready so that we can address them with our panelists. We're going to stay as long as people, well, okay, maybe not as long, but keep your questions coming in throughout the Q&A. We're going to change the view slightly here so that the presentation goes away, and then whomever is speaking and addressing your questions is going to pop up. So thanks to everyone again who has submitted questions. A quick reminder, we're not able to address specific situations about specific individuals. We're going to speak generally on issues. And we did want to clarify, because the acronym can be tricky to say, it is MRRA, standing for Minnesota, I'm going to mess it up.
Minnesota Rehabilitation and Reinvestment Act. It is hard. It's just a whole bunch of word salad of acronyms, but we're here for it.
Absolutely. So thanks for that. All right. So we're going to start off with a question regarding timing and then programs that qualify. So someone's son was incarcerated in 2024 with a regular release date of 2028. Seems to be participating in barbershop. So the question's about barbershop. Does that qualify as a reducing program? And then that just opens up. Can you speak more about those types of programs that would or would not qualify? And the amount of time, like how short or long does somebody's sentence have to be to qualify for a reduction?
This is a really great question. And first, it's wonderful to hear that your son was engaged in the barbershop program and hopefully found those skills really useful. So for recidivism reduction programming, post-secondary degrees or licenses or certificates qualify as a recidivism reduction program. So folks who earn a higher education degree, an associate's degree, a bachelor's degree, or folks who complete a licensing program like the cosmetology or barbering license program where they get a license as a result, those would qualify as recidivism reduction programs. And so in terms of the amount of time, as Kate referenced earlier in the presentation, to be eligible for earned incentive release consideration, folks must have at least 1 year to serve upon admission. So there's often confusion about, if I'm sentenced to a year, does that mean I am eligible? And it's not about the length of your sentence, it's about how much time you have to serve upon admission. The reality is that if folks are coming into St. Cloud or Shakopee with less than a year to serve, their ability to complete the comprehensive assessment process, engage in programming that targets their highest need areas, and move through the entire review process is going to be very unlikely and challenging. And so the MRRA law actually outlined the requirement that folks have 365 days or more to serve upon admission. So, and Jeremy, if you don't mind, I'm gonna answer another question that's statute related, if that's okay.
Okay.
Someone asked in the chat, the statute appears to state individuals can earn up to 17% reduction in sentence. Wouldn't that allow release at 49% sentence served and not 50% sentence since individuals are expected to serve 2/3 or 66%? 5 or 6 months earlier release could be huge for someone who may be able to see their child graduate from high school. And this is a wonderful question, and it was one of the early things that pointed to just how complicated this law is. So the difference between 17% reduction and 50% is there, and it can equate to a significant amount of time. And so the statute indicates that the maximum amount of earned incentive release credit that can be earned and subtracted from the term of imprisonment is 17% of the total executed sentence. It goes on to state that earned credit cannot reduce the term of imprisonment to less than 1/2 of the incarcerated person's executed sentence. And so as folks are coming into prison, both of those calculations have to take place, a 17% reduction and also 1/2, because according to the law, people cannot reduce their time below 50% of the executed sentence.
Thank you for addressing that, Karley. Well said. Let's turn to the victim input question. Someone's asking, how will victim input affect someone's eligibility? What if the victim can't be reached or is not in support of early release? How do we handle that?
So we make every effort we can. I'm going to address the first half, the last half, and then the first half. So we make every effort we can to try and locate victims. So we reach out, and that's partly why we're trying to do the outreach now at intake, and working closely with the county attorney's office to locate and identify victims and get them into our system so that even if it's a number of years later that somebody might come into this review process, we hopefully have good contact information for them. So, but we assume that there will be victims that we are not able to locate. And at whatever point somebody finds the victim or we locate the victim or they make contact with us, we will then start to engage with them at that point. In terms of what is the impact of victim input in this process, victim input will be considered, and it will be considered in a couple of different ways. It'll be considered once full implementation happens, when somebody gets on the intake process, when they're developing their individualized rehabilitation plan. One thing that must be considered is any victim input that is relevant to the creation of that plan, which sort of sets out what they're going to be working on while incarcerated. And it is also the plan upon which they're measured against when they get into the review process. They also have a statutory right to have input at the back end of this process as well. Now, victim input is not controlling. So if a victim says, I don't want this person to be reviewed, or I don't want them to have early release, that in and of itself isn't going to control what happens. What people are most looking for is information on current or ongoing behaviors that raise safety concerns. That's the most important information. If that behavior is happening while somebody is incarcerated, that will have probably the greatest impact in terms of what's being looked at in the review from victims. And there's also victim input. Some of it's about safety concerns about behaviors going on while somebody's incarcerated. There's also victim concern information about if this person is released, what kind of conditions should be put in place to make sure that their concerns are addressed. So there's a couple of places where it will be considered in the review process and in the setting of conditions of release. But I mean, there's lots of variations depending on the individuals involved, but that's a general overview about how victim information will be considered in the process.
Thank you, Liz. Let's talk a bit about, um, which I know this has been addressed before, but often it's a common question, so we want to bring it up regarding the amount of staff currently available to provide programming and to get people involved that they can participate in. What can you say about the availability of programming in facilities currently?
I can start us off, and Karley, feel free to chime in. I think that I know that we can never talk about this enough, and we've talked about this in the past, that if we were to wait until there was what we ascertained to be the perfect amount of programming in order to address the needs of individuals, we would never be able to get started. This is an incredibly system transformative policy. It has many technical process level components that touch upon many parts of the system, which are essentially giving individuals an opportunity to and allowing us to evaluate whether or not there has been demonstrable progress, growth, and change, and a person can earn an incentive release. With that in mind, we needed to get moving because there are so many different components to build, to learn, to test. And with that being said, I really appreciate the question about, which is really amazing, about the staffing capacity by and large across many human services, let alone the justice system, is a challenge. And so one of the reasons why we're moving in such a slow and controlled manner is because this is systems change. This is not only impacting the people that are at the center of the system, but we need to walk alongside our staff in the way that they need in order to learn the different processes, in order to make that transition to complete organizational and systems change. And so although will never have enough, we operate in this tiny but mighty team because we believe in Minnesota Rehabilitation and Reinvestment Act. And we have to continue to move forward with what we have. And with that in mind, continuing to look forward to new opportunities for programming is something that we have built in the policy, the earned incentive release policy. And it's also something that we're continuing as a system because when we know better, we do better, right? And so we'll continue to move forward with that. And if we were to wait for that perfect equation, if we were to wait for that perfect metric of the number of programming opportunities towards the dynamic needs of people that are involved, that are incarcerated in our correctional facilities, we would have never begun. Karley, did I miss anything on that?
I wouldn't say you missed anything. I would just add that since MRRA was passed, program expansion has been taking place. So additional substance use disorder treatment beds have been added. There are plans to consider additional opportunities to offer sexual offense treatment programming at different levels and different intensities in a similar way to how substance use disorder treatment is currently offered. And a lot of work has been done to explore innovative options to introduce new programming that we know is absolutely needed and to expand capacity for existing programming through things like virtual options and technology that previously we wouldn't have even considered using and have learned certainly through the pandemic can be a really effective way to deliver programs and services. And we also recognize that we can have some deepening partnerships with our community providers as well. So we understand the importance of being able to increase capacity to meet the needs of the folks who are currently incarcerated, especially those who wouldn't be able to exercise limited program capacity release options in the future.
Excellent. Follow up regarding timing. Okay, so questioner points out MRRA was passed by legislation back in 2023 and are observing through the presentation here that it's not going to be fully implemented until 5 years later. Can you speak to what was actually, the reason for that time span and the difference between it being passed by the legislation and where we are now?
Yeah, it's a common question we get and a really understandable one. MRRA represents a really important opportunity for folks to rejoin communities that are missing them. And the importance of that is not lost on the DOC. And what I'll say is when MRRA was passed and signed into law in August of 2023, it was done so with an understanding that the DOC was required to develop the policies that would operationalize that law. And policy development can't be taken lightly because it requires, based on the law, consultation with 11 different agencies. But, beyond that, there are a lot of other folks who have really important perspectives that needed to be included. And so, although it was passed in 2023, the DOC expressed a timeline of 18 to 24 months for policy development, followed by the implementation planning. And so, although 5 years feels like an incredibly long time, especially for those who are just waiting for their loved one who is incarcerated right now to be reviewed, we also think that this slow and controlled approach is the only way to responsibly introduce MRRA, and to do so without creating significant risks that we aren't making decisions in the way that we need to and in a way that really aligns with the research and aligns with the obligations within the law. And so that implementation timeline, although frustrating and unsatisfying for many, feels like it is still a critical and necessary way for us to approach this so that it can be sustained over time and we can continue to improve the process and really build trust that we're doing this methodically. And I think I would point to, we've had a couple of specific examples throughout pilot testing where we were like, yep, that is something that we had not considered, we had not planned for, and it's something that we need to immediately address and correct as we move forward. And so those are the reasons that that implementation plan is laid out in the way that it is.
Excellent. So someone is asking about more clarification on the phased um, criteria. And I think we had a couple slides within the presentation that I'm not exactly sure if this is the correct one that they were asking about, but I'm going to put it up on screen here to give you an opportunity, the panelists, to give maybe more rationale explanation on the nature of the phases, why the criteria are what they are. And I'll also mention we are getting a lot of questions in, and so I do want to try to tackle as many as we can in the next 10, 15 minutes. But this seems important as well. So.
Okay, well, I can address some of the components of this, and as always, my partner Karley will chime in if I miss anything. So, as Karley mentioned, it kind of tied into the responses in the two previous questions. The reason for the phased implementation is for learning, is for process improvement, and is for capacity building. Capacity building, oftentimes, so the learning she just mentioned, there was a couple of times, there was a handful of times actually. These are new roads that we have never walked down before, right? Oftentimes, these roads are built on promising practices that are already in existence, and we're putting some formality within them and we're scaling them up and across a massive system. So, the phased and scaled and methodical approach are critical for the process improvement to ensure that we're making the right decisions, to be able to build out the pathway forward. And then the capacity building comes within the fact that we are utilizing and teaching these new learnings to existing staff, existing systems. The correction system does not exist in its own vacuum. We are interconnected with multitudes of systems across our communities, and so the capacity building is going to be not only within our staff, but community supervision and so forth. And we are watching, observing, and learning. So this is the scaled and methodical approach. So as you can see this from phase 1 to phase 2, there is a kind of a burgeoning of or an expansion that happens as we move through to phase 4.
Excellent. Sounds good. I'll leave this up here for just a moment longer to allow people to absorb it if they can. But a related question, someone asked, if you're on the deferred list, can you request a review in phase 3?
Great question. And I saw in the chat as well, we did not introduce the MRRA, Earned Incentive Release Deferred Review Offense List, within the context of this presentation. For those who have interest, you can access that deferred review offense list on the public site. And so I don't know, we might be able to even put a link into the chat so folks would be able to click that and be taken straight to the public website. But the deferred review offense list is primarily comprised of offenses which are either defined as a crime of violence or a violent crime. It also includes some offenses from the obscenity statute. I noticed there were a few questions about murder. So, folks who have a murder conviction with a non-life sentence would be eligible to be reviewed for earned incentive release once we have gotten to March of 2027, when that deferred review offense list has been dropped. But murder convictions are on that deferred review offense list alongside other offenses that can be viewed on the public site. So for individuals who have an active offense or had an active offense on that deferred review offense list, if they're meeting all other criteria and requirements, they would then be able to request review in March of 2027 based on the facility sequencing.
And Jeremy, I just wanted to reiterate, not that I'm trying to womansplain my partner. I just want to reiterate that it's the ability to be reviewed. It doesn't mean that an individual has been approved, right? So a person can request an ability to be reviewed, but there is still a very robust review process.
Excellent. So I want to bring Liz in on another victim-related question, and I'm going to scroll here on my page to make sure I get the right one. If someone's released to their family home, is it mandatory that a victim of their family be notified of the address?
No. The simple
Great.
answer. So, yeah. So when
Simple.
somebody is released, so for any crime victim, when somebody is released, we are not allowed to say the exact location where somebody is being released to. We can give you the zip code location that the person is being released to. And then we can also, the conditions of release, other kind of information like that, supervising agent, etc. I don't know if that fully answered the question.
Hopefully, we'll give them an opportunity to submit another one if there's follow-up. But it looks like a number of the questions are regarding where can they find more information, a list of programs that qualify for earned incentive, and we already talked about that deferred offense list. I did put the public engagement site link in the chat. Either Karley or Kate, is there any other resources that you can or want to point people to regarding those questions?
Absolutely. So when we were referencing recidivism reduction programming and some of the requirements, all of that information can be found within the body of the Earned Incentive Release policy. So if you're on the DOC's public policy page, there's a blue link that says upcoming changes. If you click the upcoming changes section, you'll see the Earned Incentive Release policy listed there, and you can then read the full policy, which includes a specific list of recidivism reduction programs. Come February, when that earned incentive release policy goes into effect, it will move from the upcoming changes section of that policy site directly into the policy, the policy manual. And so I don't know if we may be able to put a link in the chat as well to the public policy site for easy
Sure.
navigation for folks. But the policy itself is a wonderful resource because it walks through the process and also the requirements, and gives a bit more detail than we provided. And that public engagement site that is linked as well, you can view information that's been put out previously, including past recorded town halls that walked through the process in more depth.
Jeremy, I think I saw a question related to where the policy site is listed on the public website. So it's all the way over on under the header of Transparency Center. And so if you click on that Transparency Center, the policy links are within there. And as Karley mentioned, the upcoming changes as well. And I will just reference that there was questions related to recidivism reduction programs, responsivity programs, and such. Within the policy, it details out a review process as well to add additional programs. So our director of research, our director of evidence-based practices, and our director of health recovery and programming on an annual basis will review additional programs that may or may not be able to be added to, for recidivism reduction programs and or responsivity programs. So again, just reiterating, a lot more detail within the policy, and that's how you can find it.
Excellent. I am just correcting a mistake I made in the chat. I sent the link to just the panelists and have now corrected that and sent it to everyone. So thank you for pointing that out. All right. So thank you for mentioning the policy page. A colleague of mine did also add the direct link in the chat to everyone for that upcoming policies page. So as another avenue to get to that. So a timely question here, maybe someone can address this regarding ICE holds. Can they qualify for MRRA and EIR? And that's the direct question.
So an unresolvable ICE detainer is an unresolvable detainer. So a person will not be able to request for earned incentive release if they have an unresolvable detainer.
Good. All right. Thank you for addressing that. So let's try to sift through the many questions here. I know another individual asked about the presentation itself, and at that same public engagement site, we will make the presentation file available for download, correct? We can have that there, so you should look for that as well. Another victim question. If the DOC hasn't been able to make contact with a victim and they haven't been given the formal opportunity to opt in or out of engagement with the victim services unit, does that impact an inmate's ability to access the EIR program?
So if there is no victim input after us making reasonable efforts to try and locate them, it will not delay the process. And if the process has been started, and then we then come up with victim input, we will feed it in at that juncture into the process, but it does not prohibit the process from moving forward.
What kind of updates can family expect regarding where their loved one may be in the process?
That's all contingent upon releases of information and what the individual shares. But I will just also say that an individual that has the ability to move forward and request a review for earned incentive release, to manage expectations, it takes us a minute, right? It takes us a few months, a month to at least more, as we're developing and we're devising these out. Also, it's dependent upon the person's experience while they're incarcerated. An individual may have to finish programming, which that happens at variable times. I will also say that there's no finite period of time because people are taking their time walking through this and making a decision. I saw a question related to work release. There are people that are currently through process testing that we have visited with who have had the opportunity to participate or pursue an earned incentive release and have chosen not. They've chosen to go to programs such as work release because that fit their future better, or what they envisioned their future to be in a better way, or they are opting out because this is not something that they are ready for at this point in time. And so people are taking their time making really important decisions, right? Making really important decisions as to what their future is going to look like and what they would like to engage in. And as much as possible, we've devised the cadence and the movement of this process to be autonomous on that individual so that they can drive forward. And it's really had some beautiful outputs as related to like incentivizing that person to take an active role in a more have the control to move forward with their future as it relates to requesting an earned incentive release.
I'd like to end with two. First, a real quick one. Let's try to make this quick. Are the phase dates subject to change? In other words, Are those rigid, or is there potential for flux?
That's a great question. Although we anticipate maintaining the timeline that we outlined in this presentation, we do have the ability to move those timelines forward. If we are able to more efficiently review folks through phase one, we will then move forward phase two. So we are not right now promising that that timeline will change. What we're saying is if it changes, it would be changed forward rather than delayed.
Great. So let's close on this one. What kind of programs or dialogue is being offered to victims, as the focus of restorative justice is truly the healing of victims and not just incentives for offenders? So I would love to hear more about what's available for victims, and I think our audience would as well.
Yeah, so one of the things we've been doing throughout this process, and we do generally in this work, is that we work closely with the statewide crime victim coalitions, which provide services primarily on a local basis to victims of crime. And so we don't provide within the Department of Corrections, we don't provide those kind of services, but what we do is we partner with the local advocacy and support services that are out there. And we're also looking at ways to expand and how can we support the coalitions and their member programs to find additional ways to fill some of the gaps that are out there for victim services. And then lastly, I would note that we've been talking about the rehabilitation side of the MMRA. There's also a reinvestment portion of the act, and that means that once the department starts to realize savings, cost savings because of MMRA, 50% of those cost savings will go and be reinvested in victim service programming. And that's the programming that is happening through the statewide crime victim coalitions and their member programs. So that's the system that we use right now. And our hope is that over time, as this gets more fully implemented, we'll be able to reinvest some of those dollars, 50% of those dollars, specifically into victim services.
That's a great point. Thank you so much, Liz, for bringing that up. Thank you to Karley and Kate for bringing your expertise and insight to the conversation tonight. Thank you to all our participants for giving your time and attention to the conversation. I'm sorry we couldn't get to every single question here, but it gives me encouragement that there's an opportunity for more engagement in future town halls. I think you'll be seeing those come, so please stay in touch on our websites that we've provided and keep up to date as those town halls are announced in the future. Look for the recording and the PowerPoint slides there for your reference after the fact. I will try to get those posted myself as soon as possible. And thank you again for your time. Enjoy your evening. We appreciate the time. Good night.